and provide some information that we didn't get to yesterday, and then we'll open it up to Q&A. So if Dr. Alomia could please go ahead with the technical report. Thank you. We're going to start with today's press conference. We've now been 63 days in the National Safe Distance campaign, and we're heading into the last full week of this national campaign. As you all know, the purpose of this campaign was to mitigate transmission and reduce infection, and as well reduce the burden on hospitals so that we could serve any sick public better. And so we're going to continue doing that even better. This week, specifically, we're going to be talking about the new intervention that is going to be starting as of June 1st. So that's returning or going to the new normal. And it's not going to be necessarily the same on a national level and the same in all regions. However, those actions and community actions are going to go hand in hand with risk management in each state in order to not have its transmission rates increase. So that's the use of the stoplights and the different colors, which will define which actions that are either more or less intense can be carried out within each activity. We'll be talking more about that so that you can start getting prepared, and the public will have all of the information about what they need to do in each color of the stoplight. So we're going to start our 86th briefing with the international perspective, as we see on the next slide. 25%, so it still continues to be about a quarter of the active pandemic across the globe, and that's stayed steady mostly over the last couple of weeks without not a lot of change. There is a little bit of change in the distribution across the globe. America is 53%. Americas, it's a little bit of an increase. It's normally around about 51%. So it's gone up slightly to 53%. Europe also saw a little bit of a decrease from 25 to 23.2%, which tells us that transmission is continuing to decrease in that region. But in the Americas, transmission levels are still continuing at the same rate, and it's gone up a couple of percentage points in the last few days. Let's look at the panorama in Mexico on the next slide. 219,164 people have been tested. They've been classified of suspect cases, and so they went into a testing protocol. 120,613 had negative test results to SARS-CoV-2, so we were able to rule out that it was COVID-19, but 68,620 is now the number of confirmed cumulative cases in Mexico. So these are people who tested positive for SARS-CoV-2. However, it's just about a fifth, so 14,247 cases that comprise the active epidemic in Mexico. So it's 1/5 of those people who started out exhibiting symptoms in the last 14 days. So as of today, these are the figures that we have. And the updated number is 7,394 deaths that unfortunately have occurred in Mexico due to complications from COVID-19. On the next slide, we see the distribution of the disease burden cumulatively of those 68,620 cases. And so now an incidence rate of 53.7 per 100,000 inhabitants. The map has stayed about the same in terms of the color gradient over the last couple of weeks, but another state has entered the highest concentration level. This shows the same disease burden, but shown in descending order so that you can quickly identify which states have the highest number of cases. We can see the changes when we look at the next slide. So now this shows the epidemic in Mexico, specifically the distribution of the 14,247 confirmed active cases. As you can see, there are some cases that are not as dark, and in some states still have not gone over 500 cases. This could change based on the number of cases that come in, but the darker colors, you can see which states are there going down to the lighter colors. We see the same distribution as the previous map, but in descending order. At the top, Mexico City and the state of Mexico continue to be at the top in terms of active epidemic or the largest disease burden that is active in Mexico. The other states still continue to have relatively low numbers, below 500 cases. The next slide shows the distribution of the cumulative incidence rate, which is 11.1 nationally, but we can see the distribution across each of the states in the country. As you can see, the map has stayed very similar over recent days. The next slide, once again, shows the cumulative incident rate, but in descending order. And in this case, Tabasco and Mexico are the ones that are leading these transmission levels. And this is used for comparison because these are based on population figures. These are the unfortunate deaths, and they're set out by day of occurrence. 7,394 deaths, but keeping in mind that there are still 595 suspect deaths as of today that are still awaiting lab results to confirm or rule out whether these deaths were caused by COVID-19. And so these numbers might go up in the next few days based on the test results. On the next slide, we see the deaths distributed by state. You can clearly see which states have had the highest number of deaths. Now we're talking about not necessarily number of deaths, but a rate. And so this explains how Mexico City and Mexico State have the highest numbers because they have the largest population within the country. So of course, it's going to represent the highest death rate. The light orange color indicates where there might be an increase because there are still, those deaths have still not been confirmed or ruled out to have been caused by COVID. Test results are still pending. On the next slide, we can see the epi curve. There's just over 28,000 cases, 68,000 plus confirmed cases. And when we see based on the date of start, based on the date of onset of symptoms, you can see that it continues upward trend. As we said in the last few days, there still might be more cases as there are still some suspect cases, because people don't necessarily seek medical attention within the first 24 hours of becoming infected. So these figures are based on the date of onset of symptoms. On the next slide, we see the cumulative burden over the last 24 hours. It was 4.2% increase over yesterday, meaning 2,764 new cases confirmed. And on the yellow bars at the bottom of the curve are the suspect cases. Now we'll talk about the hospital availability and reporting. So we have an over 90% reporting rate from the hospitals in the COVID reporting network. And of the 22,851 general hospital beds, 14,072 are occupied. So we're at a 38% occupancy rate. However, that changes by state, which we'll see on the next slide. So we will see here on this slide how that 68% is distributed. There are some states that have very little occupancy because they don't have a very high level of infection. But other states such as Guerrero, 79%, 71% in Mexico City, 58% Mexico State, and Baja California still has 53% occupancy. So remember last week, the state that was in top spot has decreased, and that goes together with the decrease in the epidemic in that state. So these are beds for critical patients, meaning beds that have ventilators. These beds are not just available or usually available in the ICU, but the majority of beds that have ventilators are found in ICU units because they are for critical cases. But before the pandemic, in Mexico, we did retrofitting, and many of those beds with ventilators and that have the supplies and the personnel to be able to take care of those patients are outside of the intensive care unit. So they're either on different floors or areas that were retrofitted. And so then those beds were assigned specialized staff to be able to have the same kind of treatment that they would get in the ICU, even though it's not that specific unit. So specifically, thanks to that retrofitting, the percentage of availability has stayed steady in those states that have the highest cases. So Mexico City, Mexico State, Baja California are the states that have reported the highest occupancy levels, but they still have good availability of these types of beds in order to take in critical patients. Thank you. Thank you, Dr. Alomia. Now we're going to open it up to questions. Thank you. You were here yesterday, so you will be next. We've been hearing about a forensic doctor, and I'm talking about Dr. Uriel Mendoza. He died due to COVID. However, at the time of his death, his family was not protected. So I want to know, what are you going to do specifically with these healthcare workers who are infected and who may unfortunately die in this battle, but what are we going to do to ensure that their families are not left out in the cold, so to speak? I think that's a very important topic. I didn't know about this specific case of this doctor who passed away, and I'm really sorry to hear that. But I think this is a very important issue. As we said before COVID, in the national healthcare system, there are nearly 98,000 healthcare workers who are precariously employed. So that means that they are hired hourly, perhaps temporarily for a year or 5 years. But there are some staff who have been hired on a fee-based system for 18 years. Some of them as long as 18 years have worked like that, and that's across the entire national healthcare system. So that means in the 32 state ministries of health that we have in the country, we have this type of hiring system. As we mentioned before, and I'll repeat it, it's against the law, against labor laws, and it's also against the fundamental principles of employment and social justice. This leads to a situation where people are seriously disadvantaged. So one of the 4 mandates that we received from INSABI is specifically to standardize all of these systems and positions. So regardless of the existence of the pandemic, we have not seen this administrative process be coordinated quite yet by INSABI, but it will continue. Given the case that you just mentioned, sorry? In the case of Dr. Elias Guzman, it makes me think that we specifically have to take a list of all the healthcare personnel, but then we need to individualize each case and what are the conditions that their employment conditions that they had specifically at the time. So we don't want this to become a barrier for their families to have any kind of financial or economic protection of, for the relatives of those people who unfortunately lose their lives. So this issue is still pending. It's open. I don't have a concrete answer, but thank you for bringing it up. And during the week, we will discuss it further. Thank you, Alfonso. And then you, Alejandro, welcome. And before all of you, please. She was the second one to put up her hand. Thank you. I'm from Eje Central, and I just want to remind you that yesterday we were still waiting for information about the pandemic in penitentiaries. How many infections correspond to people who are in detention, people who are in custody, or how many relatives who have gone to visit them have passed away. And the protocol that you presented only has to do with general authorities. What about state authorities? Is that something that we can talk about with the governors at their meeting on Tuesday, I think? So that's something that we talked about from the beginning in the preparation phase. So the way that we worked with that was that in January, we identified that any population in detention in different types of penitentiary institutions, whether it's preventive detention or post-sentencing, from an epidemiological perspective, they are a population at higher risk of transmission of any infectious disease, not just COVID. This happens with other diseases like tuberculosis, many other diseases. We knew it was very important to have a technical protocol that would specify prevention mechanisms and also response mechanisms in the event that there would be a case or an outbreak in any type of detention center. You guys all know the guideline. It's available on the webpage as of when it was published a few weeks ago. And I'd like to acknowledge the dedicated work of the Federal Organization of Detention Centers. They really helped us to identify the conditions under which these centers operate. So in federal detention centers, we were able to develop a guideline which can be applied to other detention centers at a state level or even small centers that might be below the state level even. The Department of Incarcerations itself provided technical advisory services and has reported where there have been outbreaks in state prisons. Any outbreaks that were federal, we considered along with the Ministry of Health, we considered them to be appropriately dealt with. Outbreaks were controlled, and we ensure that they keep the population is segmented in order to try and prevent transmission. In some circumstances, they have had to temporarily suspend visits to these detention centers by relatives, and it's important to reestablish that as soon as possible. because that is a reason of great concern for many families when they are unable to visit their loved ones who are in detention. So we do have information about what is going on or what has happened and what we might expect to happen in comparison to what happened during the flu epidemic in 2009. And so we're getting appropriate information from all the different respective areas. Yes, those interventions are being done by the states in which the detention center is located. So whether it's federal or a state prison. It's important to note that there is no specific variable that will identify a person who is in detention. What we do have, though, is data based on profession. So based on profession, we can see what a person's profession or occupation was, but we don't have a specific variable that will label a person that's saying that they are in detention or in prison. But based on the intervention, that statistic is part of the activities being carried out by each state. For example, in Mexico City, they requested assistance from INDRE in order to sample its intervention or the mechanisms that it has developed in order to go into their centers. They have 11 centers that are supporting INDRE by providing statistics and information. And as of Friday, there had been a total of 1,578 samples. And so that were taken for people who are in detention or persons who are about to go into detention and those who work in those detention centers. As I mentioned, the interventions are defined by each state, but INDRE has that information because they are participating in the activity. However, in other states, it is public state laboratories in coordination with epidemiological monitoring who have been working together with monitoring the disease and notifying. And this is any facility that provides healthcare services. All detention centers have a medical unit. It's part of their regulations or their standards to have a medical unit to provide services to the population in detention. So they have to follow the epidemiological protocols that have been established. So whether it affects people who are in detention or their own staff. So they provide the attention that is required regardless of who it is, and then we'll take samples in order to then report if there might be any outbreak. There's a lot of coordination at the local level, and that is basically what they are doing today. The question can't be heard. Because this is specifically in Mexico City, we are supporting a specific lab in that activity. And they are the ones who will define what time of actions will be taken based on the results. So that's information that we're probably going to have to request directly from Mexico City for their data, because they are the ones that are carrying out those actions. So we could talk to them and ask for more information about that specifically. I want to mention that Jose Avila Perez, who is the head of the Prevention and Social Rehabilitation Directorate, he's a colleague who defined and expressed all of the protocols for the decentralized penitentiary system. We could ask him to join us at the press conference or present a report on their findings, and we could share it with you. Thank you, Alfonso. Thank you, Pancho Gutierrez. What's your opinion about the document that the President López Obrador just announced? And it has to do with the WHO to be part of the group of international experts. Would you accept that or not, or am I getting ahead of myself? And then second, a lot of people have the idea that these strategies and the calculations failed and that we won't be able to transition to the new normal on June 1st at the national level. So many people are talking about that. What can you clarify about that? And lastly, for Dr. Alomia, the health measures that we've seen about safe distancing and lockdown, we know that the aim is to reduce COVID-19 cases, but have there been any other positive impacts in terms of other respiratory illnesses or any other illness at all? About your first question, I'll explain what it's all about. I would like to thank the President publicly for making that distinction for the country, that honor. So the International Health Regulation is a binding legal document for all members of the WHO. And in the 2005 version, which is what is in force right now, there were quite substantial changes to monitoring, prevention, response, and prevention and recovery measures. And that's within the entire structure of global public health system. And in particular, with respect to acute international events such as pandemics and epidemics. The regulations consider that there needs to be a group of experts, and it is called a list of experts, that would come from different professional communities across the globe and would participate in the very different forums of analysis and review and the responses of individual countries as well as the organization itself. People are invited in their capacity as experts. There is no quota per country, and they don't necessarily need to be government workers. So the issue right now was that the invitation was made to the government of Mexico, and they asked to have Dr. Hugo López Gatell on this list of international experts, specifically for his expertise in epidemiology and infectious diseases. So it was a privilege for me to be able to be considered for that in 2013 when the government of Mexico was asked, but there wasn't any enthusiasm for that. So I'm privileged to be invited once again, and the letter was issued to the government of Mexico. And so the WHO contacted me directly, which is part of the Pan American Health Organization for the American continent, and developed the regulations specifically in that region based on the WHO, and the decision was made. So it's quite a responsibility because we have to look at it within the context of this pandemic. And I expect that among some of the roles will be the analysis of all of what we've seen and developing some lessons learned, not just for Mexico, but for the whole world, so how we can respond better to these issues and learning from the experiences of each country.
And for me, it's a huge honor. I respect the WHO immensely, and I would gladly accept once that this is formalized from Mexico's government. That will be through Foreign Affairs, and as soon as this organization contacts me, I'll be ready to comply. Yes, and about the June 1st issue. We are getting near the end of the campaign for safe distancing, and it's important to emphasize that this last week, it's not about getting back to normal. Once the campaign ends, the safe distancing campaign ends, the restrictions for mobility or the functionality of workspace and public space in general, in every space in the country, won't go back to be the way it was. June 1st doesn't mean that we are going to go out and do whatever we did before. Most of the cities, Mexico City included, of course, that's not a scenario that's possible. We would put in very high risk how we are handling this epidemic. There is a very real risk for it to, so that transmissions go back and increase, and of course, fatalities. This, of course, can affect people who thought that June 1st meant that. But on the contrary, and this we've talked about in days before, there are people who would love to see a safe distancing campaign that takes way longer. But the point is that once the campaign ends, authorities and state authorities, which by law are health institutions that would have to make decisions on how to implement these regulations, these general regulations from the federal health institutions. That means that state authorities can make additional regulations, but they cannot place anything that would diminish the regulations from the federal institutions. And there is just one health stoplight. I mean, states can, of course, make some modifications considering that these modifications would make regulations more strict as to diminish transmission, but not the other way around. And we need to be very clear on that. Federal institutions cannot be diminished by local authorities in any case. There is just one stoplight that indicates that certain areas of the country have to abide by. And I understand this concern. I understand the concerns that may come up out of a situation that may be changed from what they were expecting. I understand that this can baffle some people, but it is very important to understand why this is happening. Thank you. Definitely, out of the 5 ways of transmission that happen in epidemiologic sciences, specifically with respiratory diseases, there are 2 that are more important, which is droplets and airborne. Also contact, but this is obviously once people are interacting, not because it goes through the skin, but because the skin can get contaminated by viral loads. And if we do not prevent this by washing our hands or touching our face, our nose, our mouth, transmission can happen. But that is the least efficient mechanism. I mean, it does happen, but droplets and airborne are more importantly the ones that this campaign for safe distancing is trying to avoid. This is a kind of interactions that we are trying to limit. This 1.5 meters from person to person, this safe distance campaign has to do with avoiding that kind of contagious systems. The fact that we diminish social interaction, that we stay home, that we are not going to work or to school or social activities, definitely is limiting that kind of activity. And we've seen that in the different endemic channels, not specifically to COVID, but for every respiratory acute disease that are being observed through SWIBE, which is the mechanism that reports all new cases subject to epidemiological disease. These records have diminished in a way that hasn't happened since this SWIBE record exists. There is obviously a combination between this decrease, but it has to do with the message that we sent to the population about staying home. If you have a respiratory illness that is not serious, you can stay home and just go to seek medical attention if you have risk factors or if you see some of these alarming symptoms to follow up. But definitely there is a decrease in this. And this has happened because we have diminished social interaction. And in this way, we're not just diminishing being at risk of getting COVID, but other respiratory diseases. Stationary period for the flu or influenza finished up May 19. That means that of February, March, and April, we still have at some stage proportion of 15 or 10% of the flu. It's higher, as we know, in December and January, but in this year, starting from week 14 or 15, which it was when we expected more activity from the flu, it dropped to less than 1%. That speaks as to have there been a decrease in the transmission of disease. Of course, if we are trying to diminish one, all of the other diseases that are transmitted in the same way are going to decrease as well.
Buenas noches. Juan Hernández del
Alberto, and then
Proyecto
you too,
Gaspay
please.
de Grupo Cantón. Bueno, este es un caso que
Good
le
night.
estamos dando seguimiento en el
Juan
periódico.
Hernandez from
Y este es del día
Basta Newspaper.
viernes que se dio a conocer que en la clínica 8 del IMSS
This is a
el
case that we're
cuerpo del
following
señor
up
Pedro
in the
Hernández Ávila,
newspaper.
quien al parecer falleció
At
por
Clinic
COVID,
8 at
pues no es
the
encontrado por su familia.
IMSS, Pedro
Y
Hernandez
esto
Avila
también
dead
nos da como
body
resultado
was
que
found
otra familia
by their
estaba velando
family.
unas cenizas que no correspondían a la de su familia, que es del nombre Fermín.
As a result,
Al final, el
another
cuerpo
family
de esta persona, del difunto
were
Fermín,
taking
Fermín Rosas,
some
se
remains and
llevó al
some
hospital
ashes
y esas
from a
cenizas fueron
family member
recogidas,
that
pero el
wasn't
señor
theirs.
Hernández aún se encuentra desaparecido. Entonces queremos saber en este
When
caso,
the hospital was
aquí la
full,
funeraria dio a conocer que las
they
fotos de los
took the
cuerpos
correct
que
ashes, but
presentó,
we need to
pues
know
tampoco
because this
correspondían al
person's
señor Pedro. Entonces
remains are still
aquí hay un
missing.
problema en el que queremos saber cuáles serían las
So
consecuencias
we have a
precisamente de
big
este caso,
issue here.
qué fallas se tendrían que
What would be the
corregir y sobre
consequences
todo,
from a case like this?
pues, la aparición de este cuerpo. No
What
sé
are
si
the
ustedes
flaws
tengan
that would need to be
conocimiento de este
corrected
caso
in order
o qué
to
es lo que se tendría que hacer ahorita.
prevent it? And of
Gracias
course,
por la
what
pregunta. Sí,
I don't know
verdad
if
es que
you know
planteamos
about this
al final es
case,
un caso muy
but what could we
particular
do to recover
y
these
desde luego
remains?
lamentable si los hechos
Yes,
son como los
as the
relata.
case before, this is a very
Estoy
specific
seguro que las
and very
familias estarán
sad
sufriendo
case.
una
I mean, I'm
importante
sure that families are
tribulación, un
going
estado
through
de
something
desconcierto y de tristeza. Mi solidaridad con ellas y ojalá que esto
pretty,
se pueda
a
resolver
very
de manera
sad
pronta.
stage
Los
of their
mecanismos para que esto no ocurra
experience, and I
están
hope that this can be
contemplados
solved
en las
soon.
leyes.
The mechanisms so
Hay
that these
una
things
ley
don't
que
happen
reglamenta ya la Ley
are
General de Salud
considered
específicamente
in the
sobre la
law.
disposición de
There is
restos
a
finales.
regulatory law
Existen desde
for
luego
health
procedimientos
general
administrativos
law,
establecidos en todas las instituciones
because
sobre
talking
el
about remains,
reconocimiento
it has to do
de
with
personas
administrative
fallecidas
procedures in
y
all
desde luego existe
institutions,
también la Ley General de Víctimas que tiene
specifically
una
with
condición muy peculiar
acknowledging the
porque el
deceased
tema es muy distinto al de una epidemia de enfermedades
and
infecciosas,
with
pero la
victim
hemos tomado en
management
cuenta
as
cuando
well,
hicimos el
because it's
lineamiento
a very different case
precisamente
when we are
sobre
talking about an
el
epidemic.
manejo y disposición de restos finales.
But of course, the
Entonces, no tenía
regulations are
conocimiento de este asunto, pero gracias por
about
hacerlo
the
de
management of
conocimiento de
the
todas y
remains are very
todos. Y estoy
specific. I
seguro que el
didn't know
Instituto
about this
Mexicano del Seguro
specific
Social,
case.
a través de
Thank
su
you
área
for
de
letting us
vinculación,
know about
está
this.
trabajando de
I'm
manera
sure
muy
that the Mexican
afanosa
Institute
para
for Social
solucionarlo. Ojalá que se
Security
solucione
is
pronto.
working
Gracias.
on this with great effort, and I hope this gets solved soon. Thank you. You and Alejandro, please.
Paula Betancourt de Multimedios Televisión. Quisiera preguntarle, bueno, hay
Thank
un
you
caso
and good night.
de más de 20 mexicanos que se
Multimedios
encuentran
Televisión,
varados
this
en
is
Chile.
Paula Betancourt.
Ellos refieren que ya
There is a
estuvieron en
case for
comunicación incluso a
over
través de
20
ellos con la
Mexicans that are
Cancillería,
stranded in China.
el canciller Marcelo Ebrard, pero que no han
They
recibido una
had some
respuesta
communications
concreta
with
acerca de
the
si podrán
Foreign
ser
Affairs
repatriados. Su
Secretary, with
propuesta es
Marcelo
que si
Ebrard.
quizás podrían enviar un
And
grupo
there is a
humanitario, si
question
podría
if they're
haber, bueno,
going to
qué
come back
plan
to the
podría existir
country,
para que ellos
if
pudieran
there
ser
is going to
repatriados, ya
be
que
a
les fue extendida
humanitarian
la
flight
visa
sent
de manera
to
humanitaria
them, or
primero,
how can
están
they
pronto
come back to
pues
the
de
country
expirar
since
esta
their
visa y podrían ser
visa
acreedores a
was
sanciones. Si existe algún plan para este grupo de
granted
más de
for
20
more
mexicanos
time,
varados allá en
but
Chile.
once this
Gracias.
visa expires, they could be sanctioned. These are over 20 Mexicans that are
Ha
stranded in
mantenido
China.
una enorme atención a todas las personas
Yeah, Foreign
mexicanas
Affairs
de las que
Ministry
tienen
has
conocimiento que se
paid
encuentran
special
varadas por cualquier
attention to all
circunstancia. Esto
Mexicans
también
they
antes de
know
COVID,
of
durante
that are
COVID
stranded
y desde luego
for
es
any
un proceso
reason.
que continuará
This
después de
happened
COVID. Ante cualquier
before
circunstancia, a
COVID
veces
and
una
during COVID,
circunstancia
of course, and will
política, a
remain
veces de
after.
seguridad, a veces
At
una
any
económica,
circumstances,
pero hay los
either
mecanismos, todos los
it
consulados
is a political,
de
economical, or
México en el exterior
social
tienen
situation.
entrenamiento formal y los procedimientos administrativos y técnicos para tomar cartas en el asunto.
All of these
En
ministries
caso de
are
China,
ready and trained
sería cosa de
in
actualizar
administration
el caso que usted
strategies to deal with
referiría si
this
nos deja la
thing.
información
In the
puntual
case
y
of
precisa,
China, I
pero
would
desde
have
luego
to
recordarles a los
know more
familiares,
about this
las personas
specific case.
familiares
If you could
de
leave us some
nuestros
information on that,
connacionales que están
I
en
would
el exterior,
appreciate it.
que en todo momento pueden
But I
acudir
do know
a la
that the
Cancillería, la Secretaría de
family
Relaciones
members
Exteriores,
of
a través de la página de internet,
our
a través
fellow
de
Mexicans can go
cuentas
at
de
any
redes
time
sociales,
to the
los
Foreign
puntos
Affairs
focales que
offices,
son
to the
ampliamente
website,
divulgados
through social
para
media,
establecer contacto con sus seres queridos que
and they
estén en
can
otras
see
partes del mundo.
these
Y en otras partes del mundo,
those
precisamente
websites
es a
and these
través de
places of
las embajadas,
information
los
to get in
consulados,
touch with
con los
their
que se
family
establece esta
members.
coordinación. Al inicio de la epidemia, cuando estaba
And
comenzando,
outside
como el
Mexico,
inicio de la
we
focal
have
de la
the
epidemia,
consulates and
precisamente era un trabajo
embassies to
muy
take care of
coordinado entre la
these
Secretaría de Relaciones
issues.
Exteriores y la Secretaría de Salud.
Since China was a
Logramos
focal
articular
point for this
la
pandemic,
reintegración
the
a la
health
patria de todas estas
ministry and foreign
personas en
affairs
condiciones
have
de seguridad
been
sanitaria.
working with
Entonces,
them
si
to
esto aplicara
bring
ahora,
back home all
indudablemente
of
seguiremos trabajando
these
juntos.
people who
Gracias.
are
Alejandro, por favor.
been a victim of this about this health emergency.
Buenas noches, Alejandro Alemán de Medicina Digital. Tengo tres planteamientos en relación a la base de
Hi,
datos
Alejandro
abierta
Alemán.
que se ha ido.
I have
¿Qué es la base
three
para la información que se
statements
publica
about this
tanto por la
open
UNAM como por el
database,
sitio de coronavirus?
database
En fin, se
that
utiliza muchísimo en los
UNAM
eventos
and
y
the
así se ha visto.
COVID
El primero es en
website
relación
use,
a los casos positivos antes del 28 de
and it has
marzo.
been
De
mentioned
18
here.
casos estaban,
First is about
desde el
positive
18
cases
damos
before
seguimiento
April
y
28th.
día tras día
These
aparecen
are
casos.
18
Y como
cases that
ustedes
we
han
have been
mencionado, es una
following up
base
and
de
that we keep
datos
seeing them
nominal,
day
es
after
decir,
day.
hay nombre y
And
apellido,
as you have
y
mentioned,
los
this
casos
is a
han sido
database
detectados
by
algunos casos
name.
en
These have
Aguascalientes,
names
en
and
la Ciudad
last
de
names,
México,
these patients.
en fin,
They
son
have been
18 casos
detected in Baja California,
positivos en
Mexico
a partir de
City,
enero. Entonces,
Aguascalientes. It's 18
de esta
cases,
pregunta
all
se le
of
han
them
hecho, se le hizo
positive
reforma, se le hizo la jornada. Sabemos que hay
since
un proceso
January.
de una auditoría a la base
Reforma
de
asked you
datos,
this question
pero en
before,
fin,
La Jornada too.
realmente lo que creo que
There
importa
is
aquí
even
es
an
qué tan
audit on this
trascendentes es.
database. But
Viene
in
a mí
any
me
case, I
parece que
think
hay
that what's
algo
important
en
is
enero
how important is
y
this?
antes del 28 de
Is there
febrero
an
en la estrategia
important
epidemiológica,
impact
eso sería por un
that
lado.
COVID had
Y por otro lado,
on
preguntarle,
January or before
las
February in
implicaciones
the
políticas luego son muy
epidemiological
claras, ¿no?
strategy?
A final de cuentas siempre hay un
And
cuestionamiento
of course, the
sobre
political
lo que está
implications,
pasando.
which are
Y si me
very clear.
permites, tengo dos cosas
There
más
is
que
always questioning on
explicar.
what is going on.
Gracias, Alejandro, por traer
And
esto
if you would allow, I
una
have
vez
two
más.
other things that I could keep
Ahorita la
talking
doctora
about.
Lomía nos va a
Thank you,
comentar sobre
Alejandro,
la
for bringing
mecánica de
this up
integración
again.
de esta base de datos y
Dr.
conocer
Alomia is going to
conocer
talk
por parte de las
with us
distintas
about this
instituciones cuáles
integration
son los sistemas de
mechanics
información, si es
and
siempre de una
how
sola base
different
central y
institutions
cómo se pone a
integrate into
disposición del
these
público y lo seguiremos
information
haciendo.
systems, how
Desde luego
there
muy
is a
importante que el
centralized
público los
database
tenga a la mano
and how the
para que
population can
quien
have
tiene las
access to it,
habilidades y
because it's
conocimientos
very
para
important
hacer
that the
estos
people
análisis
have
pues
access to
lo
it.
siga haciendo.
that's what we'll
No
keep
tiene
doing it.
implicaciones ni sanitarias, las políticas pues ya dirán quienes sean agentes
There are
políticos,
no health
porque no
implications,
son casos
political
que hayan
implications.
sido presentes en el
That's on
territorio
the
antes del
opinion of
registro
those
estatal.
who
Es
know
justo lo
about
que hemos explicado.
politics. But
Lo sabemos perfectamente porque la
as
fecha
far
de
as we
inicio
know,
de
there
los
haven't
síntomas
been
de estos
any
casos, la
incidences
auditoría se
since
hizo y
February
consiste
28th.
precisamente en
We know
verificar
that
la
because
existencia de
the
los
first
casos
symptoms of
y que
these
estos casos,
cases, and
el
that
estudio
was the
epidemiológico
audit was
documenta cuándo
verifying
presentaron
these
los
specific
síntomas y
cases.
cuándo fueron
And
atendidos.
epidemiological
Y
studies
es imposible
presents
que alguien
when
pudiera
symptoms
tener un
presented and
diagnóstico de un
when
laboratorio
were they followed up.
antes de haber iniciado los síntomas, antes es varias semanas antes del inicio de los síntomas, en la medida en que
And
no
for
se le había
someone
hecho
to
la
have
prueba
lab
más
tests
que después de que
before
presentó los síntomas.
symptoms
Y en segundo
presented,
lugar, permítame, en segundo
I
lugar,
mean, if this
porque
person
en
would
las
have
fechas que
to
usted
get
refiere
tested
no
after
existía el
symptoms
procedimiento
presented. And in the
en
second place,
algunos de los
the
casos
dates that you were
para hacerlo.
mentioning,
Entonces,
the
ahorita el
procedure
doctor Alomía nos va a explicar la
in
parte
some of the
tecnológica
places
de
didn't
esta
exist.
razón.
Nada más permíteme hacer una
So
mención al
Dr.
respecto.
Alomia
Es
is
que
going to explain the
eso fue lo
technological
mismo que
side of
usted
this
planteó.
database.
Y
Let me just make a
vamos, los
comment
casos los
first.
hemos estado
That was
revisando
the
a
same
lo largo de
thing
todos estos días y todos tienen,
you
o
said,
sea,
and
la
we've been
fecha de
reviewing
inicio de
these
síntomas
cases throughout
y
all these days. Yes,
posteriormente
and I
la
thank you.
fecha de registro
There
por
is
unidad
a
médica. En ningún caso
symptom
es al revés.
presentation
En
date,
algunos
and
casos
there's
sí se da que
later
hayan pasado
the
15 o
record
20
of
días
this in
para
the
el
medical
registro, que
unit,
a lo mejor pudiera
not the other
sembrar
way
algún
around.
tipo
In some
de
cases,
situación.
maybe
Pero vamos,
20 or 15
son casos
days
con nombre y
passed
apellido.
after
Son
she did
personas
the
que
record,
existen.
but
Son unidades
I mean,
médicas de la
these are
Secretaría de Salud.
specific cases,
El ISSSTE,
existing people with
hay
names and
hay un
last
caso
names,
privado, hay un caso de una
medical
persona que
units
falleció,
from
es decir, están
Mexican Institute of
identificados
Social
simplemente.
Security, of
Vamos a darle la palabra al doctor.
State Workers Institute. I mean, they are identified. Yes, and I understand what you're talking about. Yes, answering to your question, these cases were notified to the units and the corresponding units and institutions. None of them began their symptoms in these dates. And this is something that's verified with the units directly. When the sample was taken for each of these individuals was since April. This responds to a mistake of the notice of this data. The platform receives the information directly from all of the units that report these cases, both ISBER and non-ISBER units, which are second and third level. This notice goes out by someone who inputs the information directly in the system. It could be the epidemiological doctor, the treating physician. It could be, in some cases, someone who, after seeing the amount of suspect cases, maybe there is someone whose only job is to input this information. And this process can, of course, have mistakes, and it's a flawed process. What we did was to generate the notice or the request to these units because this is not something that we do deliberately through openness at a federal level. We don't go in and change the data. That's not something that the federal area does. The same medical unit with their username and their own personal password do that, or the federal entity department, which also has those characteristics, can go and make changes in this information since they own this information. And this is information that they are noticing to a system. So there is a requirement to do the correction that needs to be done. And they are proving it by paper information that's on paper and then input in a platform. And with that evidence, they're going to do the correction. And of course, it would finally end up in the central database. And we hope that soon these corrections are implemented. But it is very important to note that we as a federal, we cannot change this information.
El segundo tema de respecto a esta
No, I
base de
know,
datos
but this
es
information
la
is there
cifra de
and
sospechosos.
there's
Entiendo que
nothing
la
to do
carga es
about
matar
that.
el trabajo y no
The
siempre
second
da
question is
posibilidad
about the suspect
de poderlos
number.
procesar.
I do
Estábamos
understand
hablando
that the
de
workload
31,000,
is
que son
immense and there's
130
no
usuarios,
time to
y aquí el
process
retraso
all of them. But yesterday
detectado
we
es en
were
el
talking
IMSS
about
Querétaro,
31,000.
7
I
de
don't know how
febrero.
many are
Se han
today,
pasado mucho tiempo, es
but
un
the
caso, un
delay
niño de
presented
55
is
años,
from
ambulatorio,
Querétaro's
y en el, ese es de
IMSS
los
from February
vivos. Y en el
7th.
caso de
This
los
is a male,
fallecidos, el caso más atrasado
45-year-old
de resultado pendiente
outpatient.
corresponde al
This is an
9 de
alive
abril
patient.
a un
And
hombre
the
de
case for
34
the
años
deceased
atendido en la
is
Ciudad de
one
México
case
y
from
originario del Estado de
April
México.
9.
Aquí, igual que el anterior, digamos,
This is a
¿qué es lo
person
que se
from
pudiera hacer para agilizar
Mexico State who
de manera,
was
porque yo creo que beneficia
seen in
a
Mexico
todos
City
el
to
que
seek
haya
attention?
menos
So
casos
what could we do in a case
sospechosos?
like
Entre
this?
más
Because
rápido
I
sea
think
esto,
it's in
siempre se
benefit
puede
of
tener mejores
everyone
herramientas una vez
to
que
have
estemos en
less
otra
suspect
etapa.
cases, to have better tools
Respondiendo entonces también a esta pregunta,
when we are
efectivamente,
at a different stage of all
recordemos
of
que para
this.
poder emitir
Yes, to
un
answer this
resultado de
question,
una persona que el sistema
let's
notifica que
remember
se le
that
tomó muestra,
for us to
esta
be
muestra
able
debe de llegar
to
precisamente a un laboratorio de la red, ya sea un
notice
laboratorio
the
estatal, un
system
laboratorio
that
regional
someone was tested, we need
INVI.
to receive
Del
this
seguimiento
test,
que se ha dado, lo
either a
ideal y lo esperado
state
es que el
or a
100% de
regional
las muestras llegaran a destino. Porque
unit.
llegando a
And
destino,
what's
estas
expected
fueran
is that
adecuadas, es
we
decir, que
receive
el proceso de envío, que
100%
debe
of
de ser
these
en red de
tests,
frío,
or that
el
when
embalaje y
these
las condiciones de
tests
la
arrive,
muestra siempre sean
they
las adecuadas.
all the
Esto se mide,
conditions for
se hacen
their
controles de calidad que se están
delivery
realizando de
are
hecho en todas
the
las
correct
redes,
ones.
y el control de
We need to
calidad ha
measure these
arrojado
things. There is
un buen
quality
porcentaje, de
control
hecho está por encima de lo
included in
esperado, que es
this.
un 95%. Sin
And we
embargo,
have a very good
por procesos que
percentage
están en
over
la
what
fase
was expected,
preanalítica, es decir, antes de que la
95%.
muestra ingrese al procesamiento en el
But because
laboratorio,
of
una
processes
muestra puede no llegar,
that are previous
o
to
lamentablemente una
analysis and that
muestra
are
puede
still
llegar en malas
in
condiciones y el
laboratory
laboratorio la
testing
rechaza.
or
Sí hay
analysis,
la posibilidad,
there's a
porque la
chance for us not
persona
to receive
continúa
some tests
hospitalizada o porque
or
se la
that the
puede
lab
ubicar en su
rejects
domicilio,
some
la muestra se
tests or
repite y
samples.
se vuelve a enviar.
If the person can be
Lamentablemente, las
found
personas
at the
que fallecen,
hospital or at home,
una segunda
we
muestra
can
muchas
do the
veces
testing again
ya no
and
es
send it
posible.
back.
Sin embargo, no es que esta persona se va a quedar
Unfortunately,
sin
when
una
people
clasificación final. Podrá quedarse
sadly
sí sin un
die,
resultado de
we cannot
laboratorio,
do a
pero no
second
sin una
testing.
clasificación final, porque desde el
We
momento en que
could
fue
keep it
notificada como sospechosa, o sea, de
as
tener
a
la
test
enfermedad,
that wasn't
entonces hay una
confirmed, but not as a
clasificación que no
final
necesita un resultado de
classification.
laboratorio,
So
que
these
es la
people would
clasificación
remain
clínica
as suspect.
epidemiológica, que también llevan a cabo las unidades hospitalarias y las jurisdicciones
There is
sanitarias,
a
a
classification
través de
that
la cual
doesn't need
tienen ellos
testing,
que
which is
dictaminar
epidemiological and
todos los casos
clinical,
que fueron clasificados como sospechosos y que
through which
lamentablemente
they have
fallecieron,
to decide
independientemente
all
de
of
lo
the
que haya
cases that
pasado
were
con la muestra o con su
determined as
resultado.
suspect
Y
and
entonces en su
who
momento
passed
se tendrá
away,
también la
independently
clasificación
of
y
what
esta
happened
persona
with the
podrá ser
results or
clasificada
the
como en
sample
caso de
itself.
COVID-19,
At
si
the end,
así
we
el
would need
comité
to
dictaminador
reclassify these
lo
cases
define.
as COVID-19
Gracias, doctora
if
Luis.
this committee
Mire,
defines it
el último
as
comentario sobre
such.
la base de datos, del día 15 a la fecha, lo que se está
And just to
observando es
make
que
one
si
last comment
echan
about the
vista
database, from
coincidiendo
the
los números de
15th
lo que
to
se da a
date,
conocer aquí a las 7 de la noche y el corte
we've
de la
seen
base de
that the
datos, es
numbers
algo
that we
que
see
realmente se ha movido.
in
Estamos
these
hablando de decenas de
conferences
casos
at
o cientos de casos. Entonces,
7
me
do
hace
not
pensar
match the
que a lo mejor están
database.
haciendo
It's
otro
not a
corte
big
después
difference.
a las
It's
8 de la noche
tens
y no sé qué
or
corresponde con el corte de la base de
maybe
datos y por
cases,
la
but
tendencia que
maybe
tiene
there is a
esta
cutoff that
conferencia
happens
como de
later at 8
descripción de la base de datos,
p.m.
es simplemente una
So,
observación
but
aquí donde
the
busqué
thing is,
que
they do not
coincidan esos dos
match.
datos para que la información que
And it's
tengamos
just
pues
a
tuviéramos
comment
una sola fuente. Gracias.
Gracias. Vamos a procurar
so
que sea
that
el
you could
mismo
find a way to
horario
make
de
them
corte.
match and so
Andrea,
that there is just one source for us. Yes, we'll try to make the cutoff time match. Thank you, Andrea, please.
Por favor, nos quedan 3 minutos. Daniela, ya le estoy
Yes, we have 3 minutes
Decía
left.
Mauricio Rodrigo Alejandro ya. Daniela.
I'm changing your names now. Daniela?
Para cerrar,
Just to close, it's Sunday and we're about to start our new stage in the stoplight. Following up to Poncho and Alejandro, we had a very big debate at the WHO between China and the United States. All of the countries are part of this discussion on what is the better way to monitor and to attend this pandemic. And there's this very specific discussion about the numbers. I would like to know if you have any comments on what has happened in this last few months from the public policy standpoint. Is there anything that you think we are lacking on? Something we need to review or correct? Or if there's something that you would change. In Brazil and Uruguay, they are talking about cases before the disease was detected. The question is, would this change the decisions that have been taken? Yeah, definitely the lessons that we can learn in any event of public interest are many. And in this health crisis, there is always a formal exercise of learning. It's called lessons learned. In terms of the WHO, this is something that's considered in the international regulations. There is an evaluation committee. The general director from the organization has to determine it. A group of people get together that come out exactly out of this expert list, and they compile all the information and review how all the member countries have worked on this and how scientific evidence and technical evidence can help us create new ways of acting, this in preparation, in recovery, in analysis. I mean, this is a long process. The flu pandemic of 2019 took over 12 months, this process. It includes interviews to the countries that are members. I was interviewed at one of these because Mexico, the United States, and Canada were the first countries to start the influenza flu pandemic of 2019. I would say that this is a very early stage to have definitive lessons learned, but we can start noticing some things that may come up. One of the things that's very encouraging is the Mexican case against other countries, which I won't name specifically. It has to do with the political leadership of the country to deal with the epidemic from a technical point of view, and that it is in the hands of people who are experts on the subject, that fundamental decisions are taken by these groups of people. And of course, these have to be also founded on each part of the government, including the president, of course, which in the last instance are the ones who approve every regulation. But I think that it is pretty clear how in Mexico, in contrast with many other countries, the president took, or Mexico as a country, took a decision in a very early stage. And in G20, it was talked about at the work groups, at every meeting that we have 3 times a week. Once and again, they are repeating that the base of the ways we are going to handle this epidemic has to be based on technical and health decisions. And of course, the legal attributions for other sectors that are important to the social and economical aspect from the epidemic have to be considered. And from my point of view, this is a very important decision to make. Going back to the health regulation international from 2005, it was a paradigm shift, specifically about global pandemic management. And if I could talk about this is one of my specialties. I want to talk about how epidemics are being handled. These are more effective when there is an international or global empathy and when there is a focus on the source. It is very common that each country closes their borders and work by themselves, and that global solidarity is fragmented. This has been proven to not be a way that's effective on dealing with pandemics. I think that global solidarity and the importance of it will end up being one of the lessons learned on what needs to be done in a pandemic. So this is it. This is 1:08. Thank you everyone for your attention. We'll see you during the week.